talk about GSM and or genital urinary syndromes of menopause. There's many other symptoms of menopause that we can get into that you handle, daily. But I thought let's start off with explaining what is genital urinary syndrome of menopause, or GSM as we call it. What does it involve? How can it commonly present in perimenopausal women? What are the signs that they should look for that something is going on in our vaginal area,
Yeah.
urinary genital area?
So this is part of the reason why it's now called genital urinary syndrome of menopause. We used to refer to just women having vaginal atrophy. It was appreciated that that's maybe an insensitive term, considering how personal our vaginas are to us. It might be medically accurate, to use the term atrophy, which is a general term of when things, grow less, kind of hypertrophy is growing more, atrophy is growing less. But this is a sensitive area, especially when we potentially are spending half of our lives in menopause. So we know that estrogen is part of a pro-growth signaling pathway for a lot of our different reproductive functions. And again, if you dial this back, it makes sense. It makes sense that when you are fertile, that the hormones that are being produced as part of your fertility make sexual function then easier, right? It wouldn't make sense if you were fertile if then intimacy was then impossible or difficult. So that estrogen has different roles, and one of its very important roles is to make sure that the vagina has a healthy skin surface. This means a thickness to the actual skin inside your vagina. A thick, healthier skin on the inside of your vagina means it has better blood flow. It has what we call an epithelial surface, which sheds off extra cells. This is why we also refer to your vagina as being a self-cleaning oven, that you don't need douches and different lotions and potions in your vagina. There is a healthy microbiome inside your vagina, similar to how your gut has one. And so the microbiome inside your vagina is fed by these cells and glycogen that a healthy vagina is able to then produce. And then that is what then causes you to also have vaginal secretions. Again, I'm checking myself and trying to eliminate from my vocabulary vaginal discharge, because discharge, again, is often a term that we use when something is infected or a problem. And our vaginas are meant to make secretions, kind of like saliva in our mouth, right? So again, part of a healthy microbiome, a healthy skin surface, healthy blood flow to your vagina means all of these functions work. And then that also means that the skin on the outside of your vagina, on the vulva area, which again, a lot of women have just sort of generally talked about the vagina, but they're actually referring to their vulva. So again, I have my friend Vita here to help us appreciate that the vulva is what you see on the outside. So your labia minora, your labia majora, your clitoris area, all of this on that you see on the outside is the vulva with the opening to the vagina here. So the skin surface is different on the inside because this is meant to be the area of the vagina that is meant to make these secretions. It is meant to be moist, on a daily basis, where the vagina is not a skin surface exactly like your arm. It's a modified skin surface. It's a more sensitive area to irritants and such. And then of course you've got your clitoral area, and that's on that you can see on the actual perineum or on the vulva. And the opening to your bladder here is called your urethra. So genital urinary syndrome of menopause appreciates that your genitals, your urinary tract, these can both be affected by less estrogen as these tissues then become thinner and more fragile, and they lose a lot of their normal function. We call it a syndrome because it affects you. It affects your personal wellness. It affects your relationships. It affects other activities. Women who have problems with genital urinary syndrome of menopause, they stop exercising the same way because they're leaking from their bladder. They stop riding their bike because their vulva hurts when they're sitting on a seat. It makes them not able to perform the same way at work because they're running to the bathroom to and from their office desk, and they've got, anxiety with that, and they can have pain and discomfort. And we call it of menopause because this is specifically because of low estrogen. So that is what GSM is as a better sort of bigger all-encompassing description of the issue.